let's talk about where we can put the cups for a lymphatic cupping focused treatment on someone who has just had liposuction on their abdomen and flanks. So first, let's talk about the pressure. I would love to be able to show you the specific level of pressure on my cupping vacuum machine, but it actually is so low that it doesn't register as anything. So if you can see to the side, this is about how much tissue is going to get taken up by the cup. Very, very little. So if I put the cup up to a higher level of compression, you could get a lot more tissue in the cup. I'm really looking to just affect like the really superficial dermal structures. So what do I do if I am seeing a client, maybe it's the first week, the second week after, I don't see any fibrosis, and I'm doing MLD, and they're saying, you know what, on your pain scale, Kathleen, it's really a 4, a 5. It's really tender for me. I almost can't feel my own skin with my own hand. I don't want to give myself a massage. It's just really tender. I don't want my clients to not feel comfortable during their sessions, so I'll bring the cup out. I'll explain what negative compression is, and then I'll start right here. This is after I've already done their deep breathing and opened up, done the techniques that target the inguinal lymph nodes, the axillary lymph nodes. So I'll start here. You can see I'm almost at the pubic bone, and I'll have the cup placement here for 5 to 7 times. Make sure that they're comfortable. Then I'll move over to here, just a little bit lateral. Again, I'm still below the belly button. I'm in this inguinal watershed, 5 to 7 times. Then I'll do here in the center, still below the belly button, 5 to 7 times. Then back down here, 5 to 7 times. So if you, the theory is exactly the same that you were taught as how to clear a lower abdomen swelling with your MLD training. You can do the same there. So it's a little bit different. I am at a lower BMI, so my hip bone is actually stopping the cup from gaining some traction and actually cupping really well. So if you have that where the client is smaller and a lower BMI, you're going to use a smaller cup. This cup would be great for like a bigger a client that could have cupping, and this cup would be wide enough to be on their flanks all the way up. But I would cup here. I would look to be close to the navel at this point, and then going down. And kind of, so the idea is that we're kind of walking the cups a little bit, and we're clearing this area, and then kind of moving, the intention is to move the swelling down to the inguinals. All right, so now we'll be on the watershed area, so we're at either side of the umbilicus of the navel. And then we can pull out 5 to 7 times each time, and then the flank, which is not doing my flanks, but it would be flanks 5 to 7 times. Then you could go up here 5 to 7 times. If there's a place to go even higher underneath the breast, and this is depending on how tall they are in the torso, you might be able to get another, and then each one 5 to 7 times. And then you can go from one in the torso, you can do walking from here, and then you put the cup to here, and then if you have another place, you can go to here. But basically, what I'm thinking of when I'm doing just the lymphatic massage is where would I do my hand placement? And the only reason that I'm not doing hand placement and the stationary circles is because the client is feeling pain because of post-surgery, and even the pressing in, the light pressure that we can do just with MLD will hurt. So a lot of people are really surprised at this, and the conventional thing is like, well, MLD shouldn't hurt. But if you think about it, if someone had a really bad sunburn and you did MLD on them, they would have some skin sensitization. So it can be the same thing. After surgery, MLD is not necessarily painless, even at the same pressures at which it is painless if the person did not have surgery. And what I have found for my clients is this gentle level of negative compression with the cupping, and not a lot of cupping. I'm only lifting the tissue up, that much. If I had the suction, it falls off. That's how light the compression is, and that's how complete the negative compression is ending in between the working phase and the resting phase of this really light cupping. So that should, in my hands, this is lifting the skin in much the same way as we are lifting the skin during the MLD, instead of pushing it in one direction with our stationary circle. I'm just lifting it up, and you're getting that same skin stretch, only the skin is stretching away from the body. So whatever protocol that you enjoy with the different hand placements to clear the abdomen of someone with MLD, I would invite you to use that same series of locations, only with your cups, if you are going to do lymphatic cupping with somebody. So lymphatic cupping, cupping after surgery, after liposuction, in the absence of fibrosis, it does not have to be harder than this. All my intention is only to stretch the skin of the dermis as I'm using these cups with lymphatic cupping. Thank you, and have a good day.